I was 40 weeks and 3 days pregnant, waiting for the baby to come, waiting for the baby to come. I was getting bigger and bigger and more uncomfortable.
We'd always sort of go to bed and say, is this the night that we're going to become parents? And we're really, really looking forward to it.
It was a normal Sunday morning for us. I was reading the news, trying to get out of bed to start my daily routine, and I couldn't get out of bed. I lost feeling in my arms and legs.
So I called Dr. Beatrice Im, who was on call at New York Presbyterian, Lower Manhattan, and she said, come down immediately.
When she first came to the hospital, it sounded like a lot of her symptoms were resolving already, but because the onset of the symptoms were so unusual, we thought that maybe we should get an MRI. Here at Lower Manhattan, we do try to work together as a team. If we have concerns, we express them to each other. When speaking with my other colleagues here, it seemed like the MRI would be the way to go. We got the MRI, then we waited for the results to come in.
A few doctors, nurses practitioners came into the room with the news that there was a blood clot in my spine. And they needed to get a room available for me.
If a pregnant patient has any kind of severe neurologic issue like an epidural hematoma, they need to be transferred uptown.
We were called by the team at Lower Manhattan, which very fortunately diagnosed her.
When the patient arrived, we quickly met together, decided that the best course of action was going to be to deliver her baby as she was already full term, and then the mom was going to proceed with the neurosurgery for evacuation of the hematoma.
She was taken straight to the operating room seamlessly so that the baby could be delivered immediately, and we would therefore not delay and risk her cervical cord function.
I was having a conversation with Dr. Ina Landris. We knew we were having a girl, and I said, these ladies are my life. And she said, don't worry, you're in the best possible hands you could ever imagine.
The last person I talked to was Jeffrey Chin, who was the anesthesiologist, and all I said was, get me and my baby out of here, and he said he would.
About an hour and a half later, I met my daughter for the first time, Beatrice, and it was an incredible moment in the hallway. There was no one around, just crying. As I was holding my minutes-old daughter, Dr. Hoffman was explaining about what they were about to do at this point.
The procedure necessary was exposing the bone overlying the clot, removing that bone quickly, and removing the clot, and then closing the wound.
2 hours later, Dr. Hoffman came to the waiting room and told me that she had done unbelievably well, and that she was out of the woods, and in an hour and a half, she'd be wheeled back into the neuro ICU, and she would be okay.
For them to come down and wind up being in a neuro ICU and telling them what was going on, and coping with that, and still having a brand new baby right upstairs is a lot to handle.
Casey held Beatrice for the first time. The whole neuro ICU, patients, doctors, nurses, everyone was crying.
Hi. Yeah, good job, little girl.
I'm Janet. Nice to meet
It's
you.
nice to meet you. What an experience.
I really do think that the teamwork here helped save her life.
Yeah. So thank you for
You're seriously making me cry right now.
Oh, you guys were so fantastic.
Oh, thank you. She's beautiful.
Thanks. Yeah, she's great.
It takes an incredible amount of people, an incredible amount of communication, and to have all of those people working together on our behalf is just the most incredible feeling you'll ever have in your life.
I feel like I'm a walking miracle, that what happened to me happened and I was saved.